Hello, I'm Dr. Alexandre Amato, a vascular surgeon at the Amato Institute, and today I'm going to talk again about a topic I love, which is lipedema, bringing you the 9 most common mistakes right after the diagnosis of lipedema. So you went to the doctor, someone told you that you have lipedema, or you self-diagnosed, so you think you have lipedema. And here come the 9 most common mistakes. The first one is believing that everyone will reach the final stage of the disease. So, when you found out you have lipedema, you search on Google lipedema, you will see various images of varicose vein classification, stage 1, 2, 3, 4. There are other classifications too. And then everyone focuses on that final, that worst stage of all, and says, my God, I'm going to reach that stage. It is not an evolutionary classification. In other words, it doesn't mean that everyone will reach the final stage. Only those who don't undergo treatment will reach the final stage. And when I talk about treatment, I'm not talking about surgery. I'm talking about treatment. Both conservative treatment and surgery in some cases. But many people have their condition under control. So lipedema is a super common disease. 12% of the population has it. And it doesn't mean that 12% of women are desperately seeking help because they have it under control and will stay that way. No need to worry. The point is, if you find out you have lipedema and have symptoms, you need to figure out how to control the disease. That, yes, because if you don't control it, it can indeed progress. The second most common mistake is believing that the next step is to schedule surgery. Booking the surgery is seen as the solution to the problem. We need to understand that liposuction is just a tool in the treatment process of lipedema, and it doesn't suit everyone. Many people with lipedema don't need surgery. Surgery can be done, we perform it, we are very supportive of doing the surgery, but not as a sole or much less definitive treatment, because it won't be. I've had patients here who have already had surgery 5 times by other surgeons and wanted a 6th surgery. Why? Because she believed that surgery was the only solution. And besides, that liposuction surgery will remove a huge volume of fat. And fat is an endocrine tissue. What does that mean? Our fat cells produce hormones. They are extremely active in our body. If we remove a huge amount of fat overnight, there will be a massive imbalance in your body. That's why conservative treatment is necessary. Conservative treatment beforehand is essential for the success of a surgery. Look at what is written in the international guideline published in the United States about the surgery. Surgery is only indicated after having undergone conservative treatment. It may have been successful or it may have failed, but you must have undergone conservative treatment before considering surgery as an option. The third mistake is to panic or despair upon receiving a lipedema diagnosis. Instead, it should be comforting to understand that everything you have experienced has a valid explanation. Remember, you are still the same person you were before the diagnosis, and it will only bring forth new opportunities for you to explore. The diagnosis of lipedema will now help you improve those symptoms that bothered you before. So there's no need to panic. Don't panic. Use the diagnosis to your advantage. The fourth mistake is starting to believe everything you hear about lipedema. So for that, there's bio-individuality. I have an entire video talking about bio-individuality. I'll link it here. But what works for one person won't necessarily work for another. And also, many times people are trying to take advantage of the marketing around the word lipedema. You have to be very careful about who is really based on science and who is offering an adequate treatment versus who is just trying to make a quick buck. Look, our first scientific research that we published internationally was in 2019, and the research started in 2017. In 2017, we believed we had something to add to the international literature on the subject of lipedema. So we started back then to promote this topic and bring information to the general public. Why do I say this? Because I have a whole playlist of videos about lipedema with reliable information for you. Filter very well what you're hearing in lipedema groups or what you're hearing out there from people who claim to be experts on the subject. The fifth mistake is believing that only with a lot of money can you solve lipedema. This topic is so important that I also made an entire video about it, but it all stems from the belief that surgery is necessary to treat lipedema. So, surgery is expensive, insurance doesn't cover it. Since surgery is expensive, the only solution is to have money to solve lipedema. And far from it, most of the treatment is done conservatively. These are lifestyle changes that don't require a cent. So, you can greatly improve your quality of life without needing to spend money. Even the medications prescribed at some point in the disease, especially during a worse phase of symptoms, they are temporary, not lifelong medications. And even when we talk about surgery, and for example here we have a day hospital, we perform the procedure within our hospital, so we can offer even surgical treatment at a much more affordable cost. The sixth mistake is not understanding and separating your complaints. So, when you have a lipedema diagnosis, the complaints are all mixed together. Often, my complaint is aesthetic. My complaint is about aesthetics, but actually within that aesthetic bag, there's pain, there's mobility, there's the feeling of heaviness. There are many other complaints tied to aesthetics, but in reality, they are separate complaints. What does that mean? Because the cover aesthetic complaint, it cannot be the first priority. Mobility has to come first. And you need to be moving. Well, second, come the symptoms. Symptoms like pain, swelling. This pain and swelling reduce quality of life. We need to improve that before thinking about aesthetics. Third comes aesthetics. So, what my patients often say is this, that the aesthetics lose importance after we start treatment and improve mobility and symptoms. It doesn't mean that aesthetics don't improve. Aesthetics improve too, but it means you manage to separate the symptoms and understand where they come from. So the pain happens when I do this, so I avoid the pain. The swelling happens when I do this, I avoid the swelling. Just that already brings a huge improvement in quality of life and often reduces that initial aesthetic complaint. The seventh mistake is getting tests done without consulting a doctor. This I have seen very frequently. So someone calls to book an appointment with the doctor and the secretary already gives a list of tests that need to be done. This is such a big, absurd mistake because I could spend hours talking about it, but I will be very straightforward. Tests are supplementary. They are tests to complement what was seen in the physical exam and the consultation conversation during the anamnesis. So if you reverse the order, either you're doing a bunch of unnecessary tests, or even worse, you're trying to put everyone in the same box. What does that mean? To a good hammer, every screw is a nail. If you have just one treatment for everyone, you're going to fit everyone into a production line. And the best way to do that is to skip the initial consultation by already ordering tests. Oh, but does this patient need it? I don't know, but the treatment will be the same. I don't even know the patient, but I'll always offer the same treatment. Why am I saying this? Because one of the tests I frequently see requested for lipedema is lymphoscintigraphy. Lymphoscintigraphy is not a test for lipedema. It is a test that helps diagnose lymphedema, which is something else. Lymphedema is very easy to assess in a physical exam. The vascular surgeon is the specialist in the lymphatic system, and they can determine in 1 minute if the patient has or does not have lymphedema without the need for lymphoscintigraphy. Oh, but wow, I like getting tests done. All right, I'll tell you how lymphoscintigraphy works. You inject between the toes, so a needle goes into the toes and injects a substance. This substance is radioactive, and then you wait a long time until you go into a CT capture camera for isotopes, and this camera will measure how much radiation is being emitted by each part of your body. So look, lymphoscintigraphy is being requested left and right, and it's an invasive, radioactive, painful, extremely uncomfortable test. And if the patient is evaluated by a vascular surgeon specialist, there's no need for it. So know that if your doctor isn't evaluating you before ordering tests, it's because the treatment will be the same for everyone. And for sure, the main interest isn't in your well-being or your quality of life. The eighth mistake is believing that conservative treatment is unsustainable over a lifetime. In fact, while it's a treatment, it may seem unsustainable, but over time, it becomes an acceptance and a lifestyle change, and it stops being an effort, becoming a choice. As you do something and realize it benefits you, this change will be your choice, not something the doctor is asking or ordering you to do. So in the end, it's the small things done daily in an automatic way that change the final outcome. So, conservative treatment is perfectly sustainable over a lifetime. And this also applies to the ninth mistake, which is believing that a diet is unsustainable for a long time. As you are asked to follow a diet and it carries the weight of a diet, it can really seem. But as you make mistakes, slip up a bit, and realize you ate something that makes you feel bad, or did something that didn't do you any good, you'll naturally start choosing not to make those choices anymore. And it won't be a diet anymore. It'll be a choice. It becomes a very natural form of dietary re-education. It then becomes a lifestyle choice and not an obligation. Did you like our video? Subscribe to our channel. Wait a moment while I put up the recommendations for the best videos for you to follow, and see you next time.